Well, thank you all for joining us. Please remember that this is going to be recorded for those of you who are okay with that. We appreciate you staying online with us, and we understand if you aren't able to. But today's the next session. It's actually our fourth session in the series because our last one was canceled due to unforeseen circumstances. But our series is Being a Good Relative, Healthy Prevention Opportunities During the Winter. Today is February 14th, and it's a good opportunity for us to think about all those in our lives and in our communities that we value and that we love and that we care for. As today we're going to be speaking to a very specific topic that our presenter will share in a moment. Keep in mind that we are the National American Indian and Alaska Native Prevention Technology Transfer Center. We're one of 12 centers throughout the country that serves different communities. Our specific focus are American Indian, Alaska Native populations, both urban and rural. We're located at the University of Iowa, near the Meskwaki settlement, in the Native Center for Behavior Health. Our office is supported by a grant from the Substance Abuse and Mental Health Service Administration. The content of this event is the creation of our presenter, and the opinions expressed do not necessarily reflect the views or policies of SAMHSA, HHS, or our office. After today's event, please note that you will receive information as a follow-up to this, the slide deck with some helpful information, the links that Dr. Gray will be sharing with you as well to support the work that you do. And you'll also get another reminder about our GIPRA survey on the screen for you. You should have the little QR code that you can use your camera with from your phone, or if you just click on this link here, and I'll be happy to put it in the chat later on as well, so that you can give us feedback about today's presentation, the information that you received, and how we can continue to offer services to you in a good way for the work that you do in your tribal communities. Although we are gathered virtually today, it's really important to our team and to our presenter to acknowledge the land and pay respect to the Indigenous nations whose homelands were forcibly taken over and inhabited, past and present. We want to honor the land itself and the people who have stewarded it throughout the generations. Please take a few moments to read these last few paragraphs. And this document was created by three of my colleagues, Ella Driscoll, Keely Driscoll, and Sean Bear, all from the Meskwaki settlement, which is near the University of Iowa. For many of you who've been on this session previously or sessions previously, you may have already seen this document, but it is posted on our prevention website. It's a document that we created for those of us who serve tribal communities in regard to social wellness and prevention. It is a document that speaks to why social wellness is so important, especially during this time of year when the weather's not always good, we can't always get out of our homes and be with one another in community, and how we can help our families, our elders, and everybody stay connected to one another, as well as to our culture. And so one part of it speaks to the ideas and the resources that are important in this field of social wellness and prevention. And then the right side gives you some additional specific resources for our Addiction Technology Transfer Office, our Mental Health Technology Transfer Office, and our Prevention Office. I have the hyperlink here on the screen for you, but it is on our landing page, and I'll be happy to share that with you in the chat box also. But it's just an important reminder for our team to consider all of those who might feel isolated or unattached or not connected or just not a part of our community, because many of us live very rurally, and so we don't have that opportunity to gather like we usually do when the months are warmer and we can get out of our homes more. But for the sake of today, we're going to focus in on the importance of our elders because the past few weeks we've been discussing the importance of caring for ourselves. Back in December, we talked about how do we provide our own self-care as we transition into winter. And then we had 2 other sessions, late December and early January, where we were inviting people to talk about how we can incorporate traditional cultural values and activities through our art and working with our young people in this field of prevention and the importance of that. And then we have our next 2 sessions, one today, as I mentioned, caring for our elders as they have cared for us. And then our final session in 2 weeks will speak to the idea of storytelling through songs and the written word, because we know the importance of how we pass on our tradition and our culture is through our stories and through our songs. Sometimes it's not even singing out loud, but just the drum, our other music, our dancing that we offer tells the story of our tradition and our culture in an important way. So these are some of the sessions we've had. These are the last 2 we'll be having for this series before we get our next one, which I'll share with you at the end of today's time. Today we have our presenter, Dr. Jackie Gray. She's a professor emerita with the University of North Dakota. She is Choctaw and Cherokee descendant, and it's really important to know that she has served in so many capacities throughout her profession and continues to do so even in retirement with our center. She has served as a consultant for our office in many facets and levels, and will be assisting us on a greater level starting the next couple of weeks. And so we really appreciate the expertise, the knowledge that she shares with us. But today she's going to be speaking from her experience as the director of the National Indigenous Elder Justice Initiative that was funded since the fall of 2011 to address the issues of our elder abuse in Indian country. She is the chair of the psychosocial work group of the Strong Heart Study and developed the crisis and resiliency team model while at the Creek County Health Department in Oklahoma, where she resides at this time. She's been doing such great work across the country, in Indian country specifically. And so I want to turn the floor over to her and allow her to share a little bit about herself and more about our session today and what it means to be a good relative.
Thank you, Dr. Bez. It's really nice to be with you today. And we have a small group, so I want to make this a little more informal and more discussion. But a little bit more about me to begin with. I am a mother of 2 sons, a grandmother of 6, 4 boys and 2 girls, a great-grandmother of 1, a boy 2 years old. And as was mentioned, I'm a Choctaw and Cherokee descendant. I was faculty member at the University of North Dakota and now a professor emerita. I've been a consultant with a number of different groups around the country. I'm a musician and an elder. So with a little of that background, I want to start off with talking a little bit about what's important about interacting with our older adults, elderly, elders. Feel free to unmute yourselves and we can talk about it, or you can put it in the chat if you're going to be shy. Anyone have any ideas about what's important when we interact with them? Or things that you do? Felipe, did you want to say something?
Sure, yes. I just wanted to chime in and share that since I've learned a lot of the evidence-based practices and learning more about coming back and reacquiring my language, and then when I talk to my elders and like my parents, and that's kind of the kicker, right? The hard part is bringing it back to the heart and the home. And so when I talk to them, I'm mindful a lot of how they perceive things, staying in gratitude, and being willing to learn from their wisdom, their experiences. So yeah, they have a place. They're not useless. They're not to be discredited or discounted. And I see now where that can be kind of the bad perception or the bad thinking of how to approach somebody that's elderly. They have a very strong worth in the community.
Yeah, I think a lot of times more the Western perspective is that the older adults are kind of dismissed or pushed to the wayside, but that's not been our history. Thank you, Philippe. Nicole, did you have something you wanted to add?
Yeah, just echoing what Felipe said as well. Just, the importance of connecting across generations and how much, appreciation we should show for those that have come before us and have helped raise us and grow our families. And I think as my parents and uncles and aunts age, I see more and more of the value that they bring, both to me, but also to our youngest generation of our family. And so recognizing how critical it is to soak up the time and the lessons and the wisdom and the love and all of it before we don't have the opportunity to do so anymore.
Thank you. Yeah, I think a lot of times that we miss out, that if we don't take the time to just sit and be with them. Anyone else have anything they want to offer at this point? All right. One of the things that we developed when I was with NIJI was a poster that our elders loved it. They wanted multiple copies that they could post around their house. And it was called Ways to Love Our Elders. Let me get some things arranged here. And they really liked it because it had some really common sense types of things, as was mentioned, listening to them, hugging them, be proud of them, tell them you love them, take them out to eat, open the door, steady them so they don't fall, brush their hair. A lot of times elders, our shoulders, our joints get stiff, and it's really hard to lift your arms up to be able to brush or comb your hair, especially those with really long hair that, they had trouble with that. Have them teach you the traditions and spending time with them, making them a cup of tea, cook their favorite food, take them to a movie, sing together, dance, sweep the floor, wash their clothes, take out the trash. A lot of these things really don't cost anything except some of our time. I was telling Dr. Baez just before we started that I took these posters with me when I went to New Zealand a few years ago. And, they just thought they were really great, except they all had the same question. And it caught me by surprise. They said, "Who's been gay?" Because it said something about getting your elders a tube of Ben Gay. Well, they didn't know who Ben Gay was. So there's some cultural issues going across there, but again, it was really nice to see that this idea crossed cultures. So there are a number of things, and I will put the link to this poster in the chat. Once I figure out how to get to the chat, there it is. There you go. But so many times it isn't the big things, it's being available to do the little things and taking care of our elders. When I know for myself, I retired from the University of North Dakota and moved back to Oklahoma where my family is, but I still hardly ever see them because they're all too busy to come by. Now, when I say things like, the light went out in the utility room, and if you aren't going to be by soon, I'm going to be climbing up on the ladder and change the bulb, they get over there really quick then. But otherwise, it takes a while. If it isn't something that I threaten to climb the ladder, then I don't see them real often. But there are a lot of little things, changing light bulbs, doing those things that just take away some of those risk factors for falls and other injuries that might permanently cause disabilities or stop them from being able to interact, might cause a stroke or something like that. So we want to take care of those things. I know I even noticed that my hands aren't as nimble as they used to be. So even putting my medications out, I drop so many pills because I can't handle those little bitty pills to get them into those little containers as easily as I used to be able to. So it's amazing the types of things that may not take that much time. And you may like, well, anybody can do that. But as we get older, we're not as able to do those things. And it's really hard because we've been independent most of our lives. And to come to terms with that we can't do those things or we have to ask for help. So if you just offer to do those things rather than them having to ask for help, it makes a big difference. Sometimes I know one of the things that just and things that you can learn from them. We talked about stories, and I think your next session is going to cover more about stories, and there are things about the culture. Felipe mentioned the language, and if they don't know, sometimes our elders don't know the language either because of how they were cut off from it from the boarding school, and so they really are other things that they haven't learned the language because maybe their parents, because of their experience in boarding schools, didn't teach them the language. Maybe you can learn some words together and start building that language. Learning, beading together or learning to bead. Those little beads also are something that gets harder and harder to handle. Let me put up another thing that we developed during COVID. Because one of the things that was really important was that elders maintained that social interaction even when they were physically distancing during the pandemic. And during the winter, you've got flu, you've got the novovirus, you've got COVID. And so there are so many things that are transmittable, but there are things that you can do to share your time. And these were things that we put together that could help to stay involved with your elders, maybe even visiting a zoo together that you could watch the animals on the cameras. And there are museums, American Indian museums that you could go to online and learn different things that you could do together and talk about. There's so many YouTube videos that if you don't know how to, bead or make regalia or things like that, there are lots of YouTube videos that can kind of help you get started with it. You can watch powwows. But it was really interesting to me, some of the things that some of the different senior centers around the country were doing to help maintain that social interaction with the elders. One of the things that they were doing here in Oklahoma, because the casinos were closed, is they were doing parking lot bingo. So they would have the elders come and park, a parking space apart in the parking lot, and they get the bullhorn out and they'd call the numbers. And when they got a bingo, they'd honk their horn. They could also roll their windows down and talk with one another between cars because they were keeping appropriate distances from one another. They'd run the prizes for bingo out in the little electric carts into the parking lot. So they had a lot of fun with it. So getting creative about things. Sometimes, one of the things that they did, especially out in the rural areas, they gave each elder a piece of red paper and a piece of green paper. And if everything was okay at their house, they put the green paper up in the window so it could be seen from the road. And if they needed help with anything, they'd put the red piece of paper up. And that way, people driving by could see if they needed help and could stop by and check on them and see what was going on. Just finding little ways. We also had things, around writing letters. Most of them didn't necessarily do email, but, writing physical letters, having kids draw pictures for them. Grandparents really love that. They don't get as many of those pictures to put up on their refrigerator and things like that as parents might. So lots of different things to help increase that interaction. The other thing is sometimes the tribe will have a place that elders can go to take a walk. I know up north, a lot of times the tribal colleges, community centers, places like that, they'd have where the elders could come and walk around to get their exercise. Going and walking with them. Plenty of time to talk and visit and share ideas and tell stories and things like that when you'll go and take a walk with them. It also encourages them to get out and do that physical activity. So finding ways that you can do some of those things are really helpful. Another one of the documents that we just developed and published is called My Advanced Care Plan and Guide for Native Americans. There it is. And this is something that you could, print out a copy or take your computer and help them fill it out, answer the questions. Things that help the family in working with an elder around what they want as far as their health care, what kinds of things are important to them. Helping them get it ready to share with their healthcare provider, with family members. It asks for some basic information and things like, what matters to me? What do you want your family or loved ones and healthcare team to know about who they are and what matters to them? And it gives some little questions to the left side that can kind of help give ideas. What makes you happy? What brings you pleasure and joy? How do you like to spend your time? What are your hobbies and interests? Are there routines you like? How do you like to start your day? What makes each day meaningful? Who do you like to spend time with? Do you have cultural or religious, spiritual rituals or beliefs? And then what are some of those things? And how do you want your family to honor those beliefs? This could help in planning, can someone take grandma to the powwow or the ceremonies or other activities that may be going on that are important to her? There's same way with, helping grandpa do different things. What's going to help them with that? What worries them? Are they worried about falling? Are they worried about being able to get their medicine? So that if you know that there are things that worry them, you can talk with them about ways that you can help them address those things. And it helps to keep that interaction going. So it's not all about, do you want a DNR or not? It's more about what kinds of things are going to improve that elder's quality of life and interaction all the way through how they want things, why they're making the plan, how they want their doctor or family or whoever involved in how they make their decisions. And what things are important to them. Do they need a power of attorney? All of those types of things that can be included in this. We really tried to make this very culturally relevant. And so, it takes a lot of ways that you can incorporate information no matter what their beliefs and values are. And, as far as end of life and how they want their treatment and things like that, advanced directives, it includes that, but it doesn't, they aren't forced to fill out anything that they're uncomfortable with. So, here's something else that can be done that can be very helpful. So I've done a lot of talking about some resources and things like that. I'm going to stop sharing now so that we can see one another. And what are your thoughts seeing some of these different tools that can be used to kind of help guide some of that discussion and time and ideas to spend with elders? Yes, Felipe.
For me, and this is my own journey in learning recovery,
It's hard to hear you with the mask.
Sorry,
Oh, so microphone, that makes a difference.
yeah, sorry about that.
No, that's fine.
So right now, it does apply for me, and it does apply because I do interact with elders. We all do, and
Mhm.
it's It's tough. It's tough because it hits home. My father's under hospice care. He just turned 90. My mom's in her late 70s, and there's just factors there, and it took a lot of growing and maturing on my side to realize, hey, they're not, you know, they're boomers in their time. They've served in their time, and now it's looking at things on the opposite end, and it's hard to do that sometimes because my parents are my heroes. You know, they had a hard work ethic. They aren't perfect, but it's looking at it in a realistic way to say, how can I continue to connect with them? And getting a lot of it has to come from personal growth, spiritual growth, really. Ultimately, to be able to get over myself and say, hey, look, it doesn't matter how I feel sometimes. I honestly have to just tell my feelings to go to hell sometimes, and I have to like learn to be disciplined in a manner that's mindful towards others. That's kind of I needed the kind of the hard knocks of understanding that to see from their perspective that they've contributed a lot already, and then also the value is like it in the I'm in the middle, right? I'm in what I consider the sandwich. So it's like looking at the younger ones, the older ones. That's my role right now, and either I do it or I don't. So I'm grateful that I can do what I can, but this learning right now keeps me mindful of those different factors. So, or things I'm not aware of.
Well, and you talked about being in the sandwich generation, taking those younger ones along and helping them to be involved in doing things with those elders. It's a good opportunity for them to learn some of those things. And I don't know a grandparent that doesn't love seeing the grandkids come by, no matter how old they get. So, you know, thinking about some of those things, and, you know, some of the theme of this was, you know, how do we take care of those elders that took care of us? And, you know, down the line, it may get into changing diapers and things like that, that we don't like to think about, but, you know, those times come again, full circle. But, you know, spending that time with them and sharing those things. And I remember being at an event and watching some of the young people perform. And this older grandma that was sitting next to me told me every 5 minutes about which one was her granddaughter and what, you know, all about her granddaughter and everything like that. And then she'd repeat it about 5 or 10 minutes later. And she probably told me 20 times during that event about that granddaughter. But, you know, that was great. She remembered that about that granddaughter. And she wanted to share it because she was proud of that granddaughter. So, you know, sharing those things. I know I have an aunt that's 93, and letting her know what my grandkids are doing, which are her great, I'm not sure if there's another great in there or not, nieces and nephews. But, she, you know, I took her to a Christmas program when they were little, and she had her picture taken with them. And she, you know, when I tell them what they're doing now, and they're all over 6 feet tall and almost grown and all of this, then, you know, she still gets excited to hear what they're doing. So, you know, stay involved, keep them involved. Let those grandkids come and tell them what they're doing. I know it's harder as they get busy and in their activities and things like that. But, you know, it's good for them to learn that part of that is going and giving back to those elders. Other thoughts? What do you think about some of these tools? Any of these things are available online, and you can print them out and make your own copies or whatever you want to do with them. making them available for your program or whatever else. They're free. What about their doctor's appointments? Do any of you ever go to them with their doctor appointments so that, you know, you can make sure that somebody's getting the notes down as to what they need to be doing and can ask the questions that they're not thinking of when they get all that information coming so fast? You know, that's a lot to keep up with sometimes.
I try. My dad often resists my attempt because he doesn't think of himself as being that old yet, even though he's close to 80. But you know, some of the time, you know, looking over the medications and just checking for things that have interactions with each other, things that his doctor may not be always mindful of. I think trying to show some of that, the interest, but also that I'm not going because you can't speak to your doctor yourself. I'm going just so that I can help support you and make sure that we all are on the same page about medications and what else you're taking or what you might not remember, a supplement or something like that. And it's helpful.
Yeah, sometimes you can say, you know, I want to go so I don't get confused about, you know, how I need to lay out your meds or something like that. That I don't want to do anything that might harm your health. So I want to make sure that I understand what's supposed to be happening.
Mm-hmm.
You know, you take the responsibility for getting, let them save face.
Yeah.
Other thoughts? We've got some quiet people out here too.
In our community out here in the Paskayaki Reservation, you know, just from getting back into talking to the community, and I get to be out there and do this. And you know, the language piece is important, but it's a mindful thing because I reacquired my language after having lost it. So I'm looking at two sides of that coin. It's not, you know, we want to come at people with an ego about it. And then be mindful where people's, you know, behaviors, there's reasons for it, and just meet people where they're at. And with that, it's like looking at met a lot of people here on our reservation, probably elsewhere. A lot of folks are under hospice care, and it's looking, and it's new. And are we really prepared for that? My family is not, but we are kind of hitting the ground and just like adjusting. We're real bad on follow through. We don't, you know, we can be mindful. We can look at things in a sober way and just like plan, right? But it's the follow through. Are you doing are we doing the family meetings? Are we attending the meetings? Are we communicating? So it's all the little things that are really ultimately make up the wholeness, right? The care, if the care is there or not, or can improve the quality. So yeah, just the little stuff. But that's what I'm finding now.
So are there other things that this has helped with? Marcy says, I work with kids that are in a shelter and try to remind them that all elders have knowledge. Try to have them do special things for them down at the Senior Citizen Center when we can. Any ideas we can do for the non-relative elders in the community? You know, one of the things is maybe having the youth involved in helping the elder go through their house and looking for fall risks. And what kinds of things need to be, almost sneezed. What kinds of things are helpful, you know, as far as, okay, do they have things on stairs, or do they have throw rugs that need to be tacked down, or do they need a ramp up to their door, or is the rail on the steps sturdy? that they have something sturdy to grab hold of when they go up and down the stairs. You know, having the youth involved in going through and helping them check those things out. There's lots of little things like that. And, you know, take that poster on ways to love our elders and see if there's some things on there to maybe put together little care packages for them. You know, with the Bengay or the Voltaren or the, you know, whatever types of little soaps they might like or something like that, that you put together in a little care package for them that they can take to the elders. You know, helping clean up around their house. Maybe they just need, you know, someone to help with some of the cleaning up or mowing or something like that they can be involved with. There are lots of things that kids could be involved with, and it could be, you know, maybe going to a different elder each weekend or something like that they're helping around that house if you're taking kids from a shelter. You know, go again, you mentioned the senior center. Sometimes it can be, you know, like that advanced care plan, helping them fill out. Sometimes they don't want to, you know, their hands hurt, so they can't write, so they could tell them what they want written in there. Different things that they could do. Does that help stimulate some things, Marcy?
Yes, thank you very much. I appreciate it.
Great. Like you said, they can tell you how to make the food, but they can't do it anymore. So teaching the youth how to make different dishes and things like that, how to go about it in the right way to get it to turn out. Wonderful. These are great ideas. And it doesn't have to be something complicated or costly or anything like that. Just things that you could spend time with them. They can share something that they know, and that there can be some interaction that the youth can value spending time with that elder, and that elder can enjoy sharing with those youth. Those are wonderful things. Are there other questions or thoughts that you have around working with elders or elderly? These were just a few things I pulled together today that I thought I'd share that might stimulate some of your thoughts. I'm not saying I know everything, but you know, each community may be a little different as far as what kinds of things they could do. But making things fun. We had one elder abuse coordinator that during the pandemic, she was scheduled to have her annual conference that they usually had. And then everything was shut down and they couldn't have their conference. And so she got creative and made swag bags of, you know, copies of the previous year's speakers on a CD, and a CD of powwow music, and a water bottle, and I'm not sure what all she put in there in this bag. And she had them fill out their surveys on their elder needs assessment. And so they could pull up in their vehicle and park. They'd be given the questionnaire and they filled it out. When they finished the questionnaire, they'd hand that in and they'd get their powwow in a bag, or their conference in a bag, and could drive away. And that kept them safe, as well as having them still remain interactive. whether it's phones or learning to use a computer, or there's all kinds of things that youth can teach the elders. I know during that time, we couldn't have our family reunion because of everything being shut down and people not wanting to travel and everything. And so I said, well, I have access to Zoom. Would you want to have the reunion on Zoom? And some of my cousins said, oh no, they'll never do that. That, you know, they don't know what they're doing as far as getting on, and nobody will want to be a part of it. Well, it turned out we had like 50 people that ended up joining on Zoom, and the older aunties and cousins were the ones that wanted to do it. And so then they would have their kids or grandkids come over and get them on Zoom for them, and then keep the whole family there in the room. And so we had a connection of multiple families, and we recorded it so that those that couldn't join would get to see the recording of the gathering and the stories that were told and things like that. And they actually, well, like I said, my 93-year-old aunt was on it because it was also her birthday. And so she was on it from the time we started and was the last one to log out of it. So it's amazing some of the things people are willing to do if you have someone that'll help them work through it. All right, so do you want to tell them or put the information in about the GIPRA, Dr. Baz?
Yes, I can. I do want to share, as I'm working on that, I want to share an idea. When I worked in Navajo Nation, and we had a lot of kids with energy, high schoolers mostly, what we would do with them prior to the winter is that we would do a wood chopping gathering. So on Saturday mornings, our young people would go and do wood chopping, collecting, and delivering that to the elders. And the young people always thought, oh my gosh, look at all this work I'm doing. And they thought they were the ones providing the service. And once we'd come back and debrief at the school, they'd say, for them, it was really something that they were receiving from the elders, because not only were they there stacking the wood and making sure it was properly in a good place for the winter, so we didn't get snow and all that stuff on it, that the elders were sharing stories with them and just providing lessons to them without really the young people thinking about it. They thought, here, I'm giving this big service to the elderly. I'm doing my job. And it was really a give and take in those moments. Again, this was prior to the winter, so we would prepare for it in September and October to get ready for the cold snow and cold winter. The young people really did appreciate, and it was hard work. Sometimes they would even be given mutton stew and different things like that, where the elders would have something provided for them. So it's really important. Someone mentioned food in there, and that's what maybe remind me of that, because it was an important way to sit around and cook and eat together and provide a good service to the elders.
Well, and the winter time, at least for the northern tribes, is a time of stories and storytelling. And so transporting the elders to, you know, whether it's the shelter or whether it's the schools or where it is, to tell the kids stories. Teach them through those stories that they need to pass along. That's always a great thing. Having story time by the fire is always wonderful in the winter.
And there are some certain games that I know we do in the winter versus the summer, so that's important also, whether it's the shoe game or something else, to be mindful of that. I know we have a lady here in the Leech Lake area who is an elder who is sharing her gifts. She was one of our presenters recently, and she was sharing the idea of teaching young people right now the gift of beading, you know, the tradition of beading and the importance of that, because right now there aren't too many powwows going on anywhere, but come springtime, summertime. So she's helping them learn this important skill and tradition, so they can put together their own regalia with her help and the help of their family members, so they're ready to participate in activities like this. So thank you all.
Well, thank you all for joining me today and being willing to interact and share a few things. And I've enjoyed talking with you, sharing some of my stuff.
Hopefully you can see this slide. Thank you, Dr. Gray. On this screen here, do y'all see that link, hopefully, for our next session, February 28th? It really is going to be about storytelling and the gift of being able to tell the stories, but also write our own stories down, write our own history down for our families, and gathering that information from people in our family, gathering that information from people in our community, the elders and tribal leaders, so that we can continue to have that history passed down among our own people and the importance of that. So I'm going to try and put this link in the chat as well. I may have to stop sharing to get it, but it's on our landing page. So if you want to register for that session, let me see if I can figure that out. Are there any comments or questions of Dr. Gray? This is when you have this chance to ask an expert in this content area who's been doing this work for a long time, to learn from her and apply it to your own tribal community.
Great.
Link is there in the chat now for the next session. Thank you, Nicole.
Thank you. I appreciated being with you guys and getting to hear some of your thoughts and ideas as well.
Have a great afternoon, everybody, and hopefully we'll see you in 2 weeks.
All right. Bye-bye.